And with us now is Dr. James. Welcome to the show. How are you?
Doing well, thanks. How are you?
Good. Thank you for inviting us in.
It's great to have you.
Over the last, a couple of weeks, we've had long conversations. I've learned so much. What I was really impressed by, though, is that there's a limited number of people that have the accreditation that you have. What is that? What did you earn?
So I have a specialty in oculofacial plastic surgery, and that's a very sort of niched plastic surgeon that there are only about 20-something spots in the country that graduate every year in that specialty. So I think that gives me sort of a unique perspective in terms of plastic surgery and reconstruction.
Now, when you were younger, did you like to sketch? Were you always interested in like bone structure or dimensions? Because I know, I guess the face has seven different planes of face? Or probably multitude. Probably like 700 when it comes to you, but.
Yeah, so there are a lot of different layers and tissues to the face, and to each tissue of the face, even the skin, muscles, fat, and there are multiple levels of fat and so on, and all the way down to the bone. So, for me, when I was a kid, I knew that I wanted to help people. I wanted to be in a position where I can make them feel better about themselves. But I think also there was a big attraction to me in terms of three-dimensional challenges, and that's always something like puzzles that I've always liked to really piece together and work through things. I've probably taken apart every appliance we've had and put it back together again. So I was always working at that when I was a kid.
I remember my generation, we had the original Rubik's Cube, and I would spend hours just trying to figure it out, to the point where I got so frustrated, I just wrote away to the Ideal toy company, and I said, all right, let me figure it out. And then I could do a lot of the steps, but you're right. It is a lot of research that you've gone into, a lot of schooling. You had also shared with me that you did a fellowship, I believe, with, it was very serious. Was it a burn center that you worked in, or some sort of?
So we had a lot of specialized training in my fellowship where we worked in a burn ICU. I worked in actually a children's cancer hospital. I probably worked in 9 different hospitals during my fellowship, maybe 10. And so there was a lot of varied training that occurred with that. And I think each of those gave me a different take on what you can do, and different people and of all different backgrounds, ages, types, histories. So.
And I walked in today and I said, here is just my face with like nothing on it, just lip gloss, right? And the reason is that we're going to, I'm gonna, work with you. You're gonna help me with a new piece of technology that you have.
Yeah, so the newest technology platform we've added to the office is called the TriLift. So that is a brand new cutting edge technology. It fits really well with everything else that we do, because we do a lot of surgical and injectable rejuvenation of the face, but this doesn't require any of that. There are no injections, there's no surgery, there's really no downtime, and it helps to lift the tissues of the face. So it treats multiple levels, as you were alluding to earlier, right? So we've got the skin, we've got muscles, and the fat that's cupped by those muscles. And what it does essentially creates a workout for the muscles of the face, where it allows them to ride back up to their more youthful position. And this way it can chisel more of the jawline, fill more of the cheek, and essentially fight gravity.
Okay, that's important. And you also work with people that have maybe TMJ and things of that nature, maybe not with that machine, but just overall, that's one of the things that you help treat.
Absolutely. So I myself suffered from TMJ for many years, and I know how miserable it can be to wake up with a headache and pain on the side of your head every day. So I actually just one day got really fed up and decided to treat myself with Botox, and sort of started down that path. And that Botox is a technology that can soften the overaction of muscles, so it works really well with spasms and even wrinkle formation. Obviously, now it's probably the most common way that's used, and it's been super effective, and I haven't had to wear any night guards or any appliances and things like that. Don't tell my dentist.
I will not tell. Yeah. I will not tell. Plastic surgery, dentist, I don't know. I'm going to Botox. Right. But yeah, because I talk for a living. I've been doing it for 15 years. You were, feeling that muscle right there. I was like, yeah, because sometimes it does hurt. Sometimes I'll that. Or also during pregnancy, it was like my hips. And so sometimes like the TMJ reminds me of that same pain. It's like that joint it's just really painful.
Yeah,
So
something
it's
being
nice to
pulled
know
on.
that you can help with people with that too.
Yeah, it's really simple to do. There's no downtime with that either, actually.
Okay.
And it lasts for many months. And actually, what I found is for people with that specific concern, when we treat them, the treatments actually last longer and longer, usually as time goes on, which is sort of breaking the spasm, and then it takes longer and longer for it to build back up to a point where it's bothering the patient. So it's been really effective. I mean, that technology in general is really effective for such a wide array of things. I have athletes that come to me and they sweat a lot and they can't grip their gear, or even just people who are embarrassed of sweating too much when they work out. And it can silence that too. So it can take away that sort of extra sweating, and called hyperhidrosis. Besides all the more obvious things like we talked about, like the wrinkles and just things like that.
And I know yesterday there was another television show in here too, so you do treat a lot of celebrity faces. So you have fun, you enjoy what you do, obviously.
Yeah, I'm really lucky. It's a long road to enter into a specialty, but I think the reward is huge just in being able to love what I do, and the fact that it's a different challenge every day, and the technology is always changing, and I love learning about it and also educating my patients about it.
Yeah, I learned so much just in the last few times that we've talked, so thank you for that. And I guess now I'm gonna let you kind of look at my face, so stay tuned. We'll be segueing right into that.
So here we're gonna clean up your skin a little bit, and just to get down to those base oils and levels of the skin. So essentially what we wanna do with any energy-based device, we wanna transmit as effectively as we can, so we don't want anything in the way.
Okay.
And that's makeup, natural oils, anything that could be there. So we just clear the skin completely, and we're gonna be working mostly on the center and lower third of the face. And this treatment does have, because it's multiple technologies in one platform, depending on what we use, then we can extend to the neck and to the top of the head and forehead as well. So what we're gonna be doing is using muscle stimulation. I'm going to put a little of this coupling agent that basically allows us to, like I said, transmit as effectively as possible. That muscle stimulation is going to be felt by you just in terms of moving of your muscles. So it feels a little funny because you're not used to having your muscles move without you telling them to move while you're speaking or chewing or whatever it may be. And so in this case, I'll be in control of that movement. And you'll also feel that the area will be heating a little bit. So that just means that you're going to feel some of the radio frequency. That's another part of this technology, where the radio frequency warms the tissue and actually builds collagen once your tissue is at a certain temperature. All right, so we've set this machine to be in what it calls lift mode, which couples those two technologies that I was speaking about, the muscle stimulation and the topical radio frequency. And so I'm gonna make a really slow pulse first, so you can just see what it's like. I'll go over the lower area here. And you see how it probably feels a little funny at first. We're gonna increase that so it'll make a visible change.
Okay.
And we need a little bit more on you. We can individualize this for everyone. And so I'm gliding this over your face in order to train the machine to different muscle groups. And that way I can train different levels, so we can lift the neckline up and chisel that. We can get the cheek to be more filled and central, like those apple cheeks when people smile, and talk about a lot of youthful volume in your cheek. You can go to the sides of the face, create more of a heart-shaped face and pull that up too. And if I linger in one area, then you can really see how those pulses are working themselves all the way to the edge there.